Many people suffer from low-quality sleep and difficulty sleeping. Few may have regular episodes of wakefulness during bedtime, and few people have trouble inducing sleep when they go to bed. If you have such experiences frequently, more than 3 times per week, then it can be considered insomnia. To treat insomnia, Trazodone is used as a sleeping aid. Interestingly, it is classified as neither sedative nor hypnotic. Still, it is widely used to induce sleep. So in this video, let me explore some key facts about Trazodone that you should know before its use. The first one is a low dose of Trazodone. Trazodone is a medication that was initially introduced to treat depression. This medication causes significant sedation, drowsiness, and sleepiness in such people. This adverse effect of Trazodone is successfully converted into a benefit. Now, Trazodone is used as a sleeping aid for the treatment of insomnia in a few people. It's very interesting that the same medication that elevates the mood of the patient is now used to induce sleep. Does it have any effect on mood when used for sleep induction? Certainly, no. The reason is that the doses used for 2 purposes are quite different. As an antidepressant, Trazodone is used in a dose range of 150 mg to 400 mg. However, as a sleeping aid, Trazodone is used at a low dose, starting from 25 mg to a maximum of 100 mg. Obviously, at such low doses, Trazodone may not induce mood swings. In addition, it may have fewer side effects at such a low dose, making it widely used for the induction of sleep. Second, less addictiveness. Another reason for the wide use of Trazodone as a sleeping aid is its lower addictiveness compared with other sleeping pills. Many of the drugs are approved to treat insomnia, including well-known benzodiazepines and non-benzodiazepines. Benzodiazepines are well known as benzos and include many drugs like alprazolam, diazepam, and lorazepam. Non-benzodiazepines include drugs like zolpidem, Zaleplon, and esopicolone. The latter group of drugs is commonly known as Z drugs, as their name starts with the letter Z. Even though these drugs are well tolerated, they may still show little dependence, especially at higher doses. In spite of their little potential for drug abuse, they may still cause either physical or psychological dependence. In addition, benzodiazepines may cause jerky muscle movements and daytime sedation. In contrast, Trazodone is not a controlled substance, and it is free of the above side effects. Lack of sexual dysfunction. Trazodone blocks the reuptake of serotonin, but it is not an SSRI. Later categories of drugs are called selective serotonin reuptake inhibitors. Drugs like fluoxetine, fluvoxamine, and sertraline are SSRIs, and they share some similarities with Trazodone in their mechanisms. Both SSRIs and Trazodone inhibit the reuptake of serotonin at nerve junctions. Due to their similarity in their actions, we may expect some similarity even in their side effects. SSRIs show few side effects, like sexual dysfunction, agitation, and insomnia. However, Trazodone is free of these side effects. Importantly, it doesn't cause any sexual dysfunction. Tricyclic antidepressants, called TCAs, are another group of antidepressants often used for insomnia. TCAs show still more troublesome side effects and are less tolerated. Again, Trazodone is not producing such side effects. Lack of memory issues. Another important limitation of benzodiazepines in treating insomnia is their effect on memory. Benzos can cause an impairment of memory that complicates daily activities. They can cause confusion, causing people to forget things, even places where objects are kept. This is especially troublesome for the elders. Fortunately, Trazodone does not cause any impairment in the memory, and it does not induce any state of confusion like benzos. Common side effects. Normally, Trazodone is well tolerated. When this medication is used as a sleeping aid, especially at low doses, it causes very mild side effects. As Trazodone induces sleep, many of the side effects are related to sleepiness. Use of this medication can make you feel dizzy and drowsy. You may have disorientation and be tired from a lack of energy. It can also cause headaches. Dry mouth is another side effect commonly observed. Occasionally, it can also cause constipation or even diarrhea. Effects of overdose. Rarely, trazodone causes serious side effects as it is used at low doses. However, in cases of overdose, it may cause a few significant side effects. The normal dose range of trazodone as a sleeping aid is variable, from 25 mg to 100 mg. For the treatment of depression, it can be used at a maximum dose of 400 mg. Beyond this dose, it can be considered an overdose. At such an overdose, it can increase your heart rate and make you feel very tired. You may perceive a few hallucinations or even suicidal thoughts. So it's always better to avoid overdosing on trazodone, which is quite easy when it is used at a low dose as a sleeping aid. Unique action of trazodone. Trazodone is classified as SARI. It acts as a serotonin antagonist and reuptake inhibitor. That means it is a medication with dual action. However, inhibition of serotonin reuptake is mainly observed at higher doses of trazodone. This is mainly responsible for its antidepressant action. At low doses, it mainly blocks serotonin receptors and inhibits the actions of serotonin. These are the neurons supplying serotonin, and they form a junction called a synapse. On the postsynaptic neuron, a few receptors, like 5-HT2A, are located. They carry the chemical signal of this neurotransmitter when serotonin binds to them. This activation is mainly responsible for arousal and wakefulness. Trazodone blocks these 5-HT2A receptors even at low doses. This action of trazodone improves sedation and the induction of sleep. Apart from that action on serotonin, trazodone blocks a variety of receptors in the CNS that may add to its action as a sleeping aid. Among them, its blocking action on histamine H1 receptors is of important concern, as it causes sedation. Approval status. Trazodone is approved as an antidepressant to treat depression by the FDA. Even though trazodone is widely used as a sleeping aid at low doses, it is still not approved by the FDA for the treatment of insomnia. So trazodone is used as an off-label medication for managing insomnia. Due to its mild side effects, safety, and lower dose of use, trazodone is still prescribed by many doctors as a sleeping aid. Reversal effects of trazodone. Even though trazodone is used long-term to treat insomnia, it may not correct the root cause. It just improves the induction of sleep and makes you feel better while waking up. However, this may not correct the sleep disorder. So when you stop taking trazodone, you may again have sleeping problems. That's why trazodone is considered only as a sleeping aid, because it helps you relieve symptoms of insomnia. To get better sleep throughout your life, you should make a few lifestyle changes along with the use of trazodone. Using breathing techniques, relaxation exercises, and changing food habits may lead to better sleep while on trazodone. Patients with a history of heart attacks. Trazodone acts as an antidepressant at higher doses, up to 600 mg. This medication has some potential to prolong the QT interval in the ECG, and it can increase your heart rate significantly at such a high dose. But when it is used as a sleeping aid at lower doses, there is less risk of an increasing QT interval. However, when it is used in people with recent heart attacks, this thing is more important. In such cases, trazodone can further increase the risk, even at low doses. Therefore, trazodone should be avoided in such cases, even as a sleeping aid. So that's all, guys. These are the essential things you need to know before you use trazodone for sleep. Thanks for watching this video, and if you find any interesting facts about this medication, share them with us in the comments section. Please don't forget to subscribe and hit the like button. I will come up with another interesting video next week. Until then, have a nice time, take care, and goodbye.